The following video will give you a brief overview of how to complete the discharge process for your patients using OneChart. The first step of the discharge process is receiving an order that your patient is to be discharged. This can be accomplished from your Care Compass screen. By clicking on the sunburst icon, you can look at your new order notifications. Locate the discharge notification and mark as reviewed. The Discharge page is found on the Patient Summary tab of the patient's chart alongside the S-bar pages and handoff tool. If you do not see a tab labeled Discharge, select the plus sign and then the Discharge option. The Discharge tab is an interactive page similar to the handoff tool, which allows you to review patient data and identify necessary items that need to be completed prior to your patient being dismissed. The available options or sections are listed in the column on the left, and the information contained in each section is displayed on the right. Note: if you are viewing this page on a smaller screen, you may need to select the tab on the left to view the section listings for the Discharge page. You can navigate between the different sections by clicking on the section name or by using the scroll bar on the right. Again, the Discharge page's functionality is similar to the handoff page, where you can rearrange the sections by dragging and dropping them in the order you'd prefer. Unlike the handoff tool, the Discharge page has 5 sections that should be completed prior to discharge, which are marked with a red asterisk. These 5 sections are the problem list, follow-up, discharge documentation, discharge medications, and patient education. Once an item has been properly addressed, the red asterisk will be replaced by a green check mark. Having a green check mark for these 5 sections is preferred but not required in order to dismiss your patient. Let's briefly review each of the sections within the discharge page. The first 4 sections shown here can be used for review purposes. They include the care team, outstanding orders, and documents section. There are no requirements for these items. The care team section allows you to view which providers are assigned to your patient. If you hover over the name of the provider, you can see their contact information, such as their office phone and fax numbers. The outstanding orders section allows you to review orders that still need to be addressed prior to dismissal. The orders section is used to view orders on your patient. And the Documents section allows you to review notes by other providers and staff. You can add additional notes if needed using this section by selecting the plus sign. Let's move on now and review items that are marked with the red asterisks. The Problem List section is used to view and update the patient's diagnoses and problems. Remember to change the classification option to All from the drop-down menu to review all problems. To complete this requirement, at least 1 diagnosis, or this visit problem, and 1 chronic problem must be added for the current encounter. Note: only a provider, such as a physician or mid-level, can add diagnoses for this visit. However, nursing can add chronic problems. Review all nursing and interdisciplinary problems and resolve any problems as appropriate by selecting the Resolve option. It is important to review the patient's diagnoses and update them prior to discharge. If a condition was addressed during the current visit, but is in fact a chronic condition, you can select the chronic option to update the patient's chart and show this diagnosis for future visits. If a chronic condition was resolved during the current visit, selecting the Resolve option will add the diagnosis to the patient's past medical history. The Problem List section does not need to have a green check mark in order to dismiss your patient. The Follow-up section is used to add and view the patient's follow-up information. To add items, it is recommended to select the plus sign and document the pertinent information. At least 1 follow-up action must be added to satisfy this requirement. The Discharge Documentation section is a requirement for nursing to complete. This section allows you to review any previously charted discharge documentation for your patient. To complete this section, you can add your discharge documentation by selecting the Nursing Discharge Summary from the drop-down list. The form allows you to document where the patient is going, what equipment or devices will be needed, the discharge time, and what valuables and belongings will be going with the patient. Selecting the green check mark will sign the form. The Discharge Medication section is next. This section is used to identify what medications the patient is currently on or needs to restart following discharge, and if the physician has reviewed and completed the medication reconciliation for the patient as indicated by the status section. It is important to ensure that the patient's discharge medications have been updated by the physician prior to dismissal. This will be indicated by a green checkmark next to the Discharge MedRec status located in the top right corner of this section. Please note that this section includes information from both the patient's medication history obtained during admission and the discharge med reconciliation performed by the provider. This is important to know when reviewing the last dosing information for the medications listed. The medications that are marked with a paper scroll before their name are populated from the patient's med history. The last dose displayed indicates the date and time of the patient's last home dose. It is recommended to obtain the most recent dose of all medications from the patient's MAR. The patient education section is used to review what education the patient has already been provided during their encounter. You can also add education materials for your patient by selecting the plus sign. Although the IV stop times does not have a red asterisk in front of the section name, it is an extremely important area to address as IV stop times are needed for correct patient billing purposes. All IV meds listed in this section need to have stop times documented even if you were not the nurse who administered the medication. To chart this information, select the Document Stop Times button. The last item is the Quality Measures section. This will allow you to review which quality measures have been completed and which ones still need to be addressed. Document on any incomplete measures when applicable. To complete the discharge process, select the exit door icon located next to your various page options from your Patient Summary tab. A new window will open which will allow you to review, sign, and print the final documentation that will be sent home with the patient called the Patient and Clinical Summaries. This concludes the final steps in the discharge process.